And welcome back to Studio 3. Today we're talking about dental emergencies with Dr. Kristen Simpson from Simpson Dental. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
Yeah. So what would qualify as a dental emergency?
Well, you often have these things happen and you worry about what to do if any of these emergencies happen. So I thought I'd go through some of the common things that might happen with your teeth. The first one is, of course, what people have nightmares about is about losing a tooth. So having a tooth knocked out, which this is something we often see, with kids as they're playing. So definitely make sure in sports that they're wearing those guards to protect their teeth. But if a tooth is to get knocked out, the best thing to do is to put it right back in the spot it came out of. If you can't put it right back in the spot, keep it in a person's own saliva is actually the best thing to do. If that's not possible, then put it in either milk or water just to keep it hydrated until you can get to the dentist or the emergency room. And of course, time is of the essence, so within about half an hour you need to get somewhere to get it treated.
Oh yeah, and I remember back when I was in junior high, I chipped my front tooth. I don't remember much about what we did to get the tooth and me to the dentist, but anyway, that was, I remember, a dental emergency.
Yes, so that is another one, a chipped tooth. So a lot of times it depends on where the tooth is chipped, how much of the tooth is gone with what the treatment is going to be. If a lot of the tooth is gone, you might end up needing a root canal and a crown on that tooth. If it's just a little tooth on the edge that's chipped, you might just need like a composite bonding in that area or a veneer to cover the front and the edge of the tooth. So it just depends on how severe the chip is.
Yeah, bonding and then a veneer. That's what I ended up with. Well, what if someone loses... Yeah, it's fine. But what if someone loses a filling? What should they do? Should they go to the doctor immediately?
Well, if you can't get to the dentist right away, you can use like the over-the-counter temporary filling material to put in there. But a lot of times people will do that and then it doesn't hurt, so then they just delay going to the dentist. Well, it's just going to get worse, so you definitely want to go as soon as a tooth chips.
Okay. Is that the same thing you would recommend if a crown actually comes off?
Yeah, so if a crown comes off, more than likely there's something wrong underneath the crown. There might be some cavity around it that caused it to come off. So you definitely need to see the dentist. If the tooth seems to be okay, you can put the crown back in place, maybe using a little bit of Fix-A-Dent, until you can get to the dentist to have it looked at to see if it can be re-cemented. But teeth will shift really quickly, so you don't want to wait too long with that crown being off.
Okay, what if you notice part of your mouth is swelling? What type of an emergency is this? What typically would cause it, and what should you do?
So if you have swelling, that means there's probably infection in the area. So that's an emergency that you definitely need to get treatment as soon as possible. So that's something you should, if you can't get to a dentist, go to an emergency room because you're going to need an antibiotic to treat that. And then, of course, you need to address the source of the swelling, which would probably be a tooth. So find which tooth is causing that swelling and have it either treated with a root canal or taken out.
Okay, well, talk to us about bleeding, if we notice bleeding in our mouth.
Right, so if you have bleeding when you're brushing or flossing, that's not normal. A lot of times people will say, oh, I always get bleeding when I'm brushing. Well, that means you have gum disease in your mouth and you need to get that treated. So healthy gums don't bleed when you brush or floss. So if you have an area of inflammation, something's causing that inflammation, either plaque or tartar around that area, so you need to see your dentist about it.
Okay. What if you're having a little bit of pain in your mouth, gums, or teeth area? Is that something we also need looked at very soon?
Yes, pain. I mean, if you have pain, more than likely it's an abscess tooth. So that infection is what's causing that swelling and pain. So with an abscess tooth, it either needs a root canal or taken out. So you definitely need to go get that looked at right away.
Okay. It sounds like a lot of these things, we just need maybe better preventative care. What tips can you remind us of today?
Exactly, yes. Preventative care is the best way to address catching these things early so you don't end up in any of these situations where you have emergencies. Of course, some of them are unavoidable, so you'll have a relationship with a dentist if you're seeking regular preventive care where you can get in to get those emergencies taken care of as well. So that's definitely the best way to go.
Yeah, and it also sounds like don't put anything off. You know, get in touch with your dentist as soon as you can. Well, Dr. Simpson, thanks so much for sharing all this with us.